Hello, my name is Robert Molnar, and I'm a vascular surgeon with the Michigan Vascular Center. We established the Michigan Vascular Access Center in 2005 as a comprehensive center for the patients with hemodialysis access needs. We wanted our comprehensive center to be centered on safety and quality, and we wanted our standards to be at the level or superior to the hospitals in which we worked. Our office is staffed with a vascular surgeon, an advanced provider, a registered nurse manager, registered nurses, medical assistants, scrub technologists, registered vascular technologists, and radiation technologists. We are excited with the opportunity to participate in the SVS accreditation process, and we are hopeful that our center will meet the standards as we continually try to improve our care for our patients and our community. Once the patient arrives at the office, they are greeted by our front desk personnel. Their identity is confirmed, and then they are ushered to a private exam room by a medical assistant. Here, the patient will have their H&P updated as well as their medications updated. They will be seen by the vascular surgeon or advanced provider and determine whether or not additional testing might be needed. Should a vascular lab study be indicated, they can immediately go to the vascular lab for that study. Our vascular lab is IAC accredited, and the registered vascular technologist will complete the indicated exam and review the exam with the provider. If a procedure is indicated, the patient will then be taken to the preoperative area where further assessment and consent will be obtained.
Our office has two separate preoperative areas to accommodate patients depending on the procedure indicated. The first postoperative area is for patients who require less recovery time, such as a fistulogram or a permacath insertion. The patients requiring longer recovery time, such as an angiogram, are taken to our second preoperative area that is equipped with a stretcher to transport the patient to and from the surgical suite. After proper consenting is complete, the provider transitions the care of the patient to the circulating nurse in the surgical suite. While the circulating nurse is taking the patient into the room, the provider will utilize the scrub sink to prepare for the procedure. The procedure room is staffed with an ACLS registered nurse, a radiology or surgical technologist. In more complex cases, both will be available, as well as additional nursing staff. The surgical suite consists of all the necessary equipment needed to perform the procedure safely, as well as those devices needed for complications. Following the procedure, the dirty instruments are taken to the designated area for proper processing and sterilization. The patients who need longer-term recovery are taken to the second preoperative area, which requires additional care to prepare for the procedure. Typically, these patients require sedation and pain control that is kept in the secure lockbox. Our angio suite is set up similar to our other surgical suite with the addition of power injector, orbital atherectomy, and laser device. Each room has a designated cart with appropriate medication for the nursing staff to use, which includes heparin, Narcan, and blood pressure medication. In the event of an emergency, the crash cart is readily available with backboard, AED, medication, and airway management devices.
If a procedure is indicated, but the patient does not want to stay today, they are taken to the scheduling desk where they are offered an opportunity for an appointment at their convenience. We want to thank you for the opportunity to participate in the SVS certification program. We are committed to the highest standards of patient safety and quality and hope this process will enable us to continue to improve